Good afternoon, everyone, and welcome to our panel on keys to successful digital health software implementation. I know yesterday we started off hearing Michael talk about some of the reasons why projects failure, so it's nice to have a good, robust discussion on why they also succeed, but also some learnings along the way as well, and hopefully everyone can take away some key points and learnings from this conversation as well. Before I pass it over to our wonderful panellists to introduce themselves, for those that don't know me, my name is Megan Lane and I'm the Tamanu product owner. I've been working in the implementation of electronic health records for about 8 years now. My career started in the Australian public health system, implementing EHRs in some of the major public health systems across the eastern seaboard, before coming across to beyond essential systems, helping with some of our program management, and now shifting over to product ownership. So it's been a really fun journey and road at times, maybe stressful. I'll hand it over to Lenara first.
Thank you. So I'm Lenara. This is my 8th year at the Ministry of Health, and I'm the manager for information technology.
Good afternoon, everybody. My name is Vae. I'm a nurse, midwife, and I just graduated last year with a master's in public health and HCD. So I've been working as a nurse for more than 20 years. So I think it's a privilege to be part of this forum. So if you have any question, you just ask according to my scope of practice. Thank you.
Good afternoon. My name is Whitni. I'm from the Ministry of Health and Human Services in Palau. I'm a freshman in the medical world and come from another industry, but my heart is in this industry.
Nice. Well, thank you all. Thank you so much for chatting. First of all, with a quick question to cycle back through our panelists, just to provide a brief summary to give some context to the audience on what the Tamanu implementations you've been engaged with have been. Is it been at hospital level, more at community level? I know we've got mass vaccination campaigns, etc. So maybe just a quick one sentence on what implementations of Tamanu you've been engaged with. Maybe Lenara, you want to start?
I'm from Nauru. So the Tamanu was rolled out in the main hospital. Well, you have seen the PowerPoint presentation that Nauru is a small island. Everybody knows everyone. So that was rolled out in the main hospital in July on the 19th. So it was fun and it's really good.
Thank you. So for Samoa, we rolled out starting off with the immunization module. We're also using it for, as Adina presented this morning, for our NCD screening program and for Samoa. We're also using it now for our birth recording of births. We're also rolling out the use of the syndromic surveillance data entry from the health facility level on Tamanu. And also, we are also using it for patient management. We started off with, we wanted to use an area where there's a smaller number of patients. So we started off with the ENT clinic, then slowly moved into the eye clinic. And now we're implementing it from out in the health facility inwards. So we will slowly be transitioning all the medical records in the health facilities and in the main hospital from the current state that is in to from the old PADIS number system to using the Tamanu number. Thank you.
Hi, and so we rolled out Tamanu in November 2022. Tamanu is currently at our Palau National Hospital. Also, like Nauru is the only hospital. And so we rolled out Tamanu on outpatient services in the hospital, including special OPD clinics and inpatient services, and of course, the ER, which is our triage.
Fantastic, thank you so much. All right, we're gonna dive straight in now, Lenara. I've got I think the tough question for you here, but so first and foremost, planning is incredibly important to a successful implementation. So with that, establishing a shared understanding and strategic plan for the implementation of a digital health software such as Tamanu is crucial to support and also to directing planning efforts, especially when you may have limited resources available. So what did this initial stage of planning look like for the team in Samoa? And as you continue to expand the use of Samoa, what are your ongoing processes to review that strategy as well?
I feel like I'm answering a tangent. Okay, thank you for my question. So, as I mentioned in my presentation this morning, we've been planning our in-health system for quite a while. We've been engaging the assistance of WHO for designing an in-health system that would fit our context. So from 2013, we had a TA, another one in 2015, 2016. So we've been meeting up with the different divisions, gathering requirements, their needs, what they expected out of the system. The good thing about that is the users are actually giving us what they want out of the system instead of us just getting a system that we think will be fit for everyone. And then we developed our e-health strategy and policy in 2017 before CNLIF. So we were both heavily involved with the development of e-health policy and strategy. It's really important because that document is like our Bible for the system. So every time we want to check what is needed, it should be all in the digital, in the e-health strategy. Usually when discussing health information systems, we tend to lean heavily towards a system. And then we forget about the hardware, and we forget about the infrastructure. We forget about the human resource. So by having the e-health strategy in place, we were able to slowly implement things that were implementable. Of course, we hit halfway through the strategy, we had measles, we had COVID, but still the strategy was valid. So taking lessons learned from measles, we just went through the strategy and then started action from there. And then when we were exposed to Tamanu, already the features of Tamanu addresses a lot of the features that our users are already requested to be required, that they required out of the system. So it was easy. So those requirements we set to BES, and then there was a discussion back and forth. The other good thing about our discussions with BES was there was still room to further contextualize Tamanu as it was. So it was not a set system. Like we still had the opportunity to modify according to what we needed. And then going forward, sustaining. So our e-health strategy expired in 2022, but technology changes, and with the new e-health strategy, digital health strategy we'll be implementing, and we will be reviewing next month in September. We will further engage all the stakeholders that will be involved, and I think this time with topics such as the national ID, CRBS, the street addressing system. It does not lie in the health sector, it's outside of a different entity. So we will make sure that we engage the external stakeholders so that we can build this interoperability discussion with them, so that when we build the system, we will further address our issues across the board.
Fantastic, thank you so much. All right, Vi, I might hand the mic over to you now. I think secondary to obviously your strategic plan, you know what direction you're heading in, and starting to actually review your current state or your current processes within your hospital, particularly in Nauru, to ensure all requirements were gathered, and that you're ensuring a robust system design. So what did some of the processes look like for you to capture those current state processes for your hospital, in preparation to plan for a transition to Te Manu? How did you engage the team on the ground there?
Thank you for the question. Te Manu, the government of Nauru, that was the dream for, I think, 1990s to become, to use electronic. So until then, just for this year in July that we finally start with this Te Manu. So I think before we prep for this Te Manu, we have engaged with all the staffs and the workers that we are going to roll out the Te Manu. But with the public, the people that are coming for outpatient, they are not aware of that. So when we start talking to the nurses at the outpatient, they sort of react negative, because of the crowd they might face. So just reassure them that the management level will deal with the outpatient, like the crowd for waiting. So that's what we did before, but otherwise it's went well. It just like it takes time for the staff to learn how to be fast typing and all this. But the best staff, they work very well with us, and they bear with us with our slow typing, or especially these elderly staff. They are more than, I think, 50 plus or more than 60 plus. Imagine in those days they don't have computers, so it takes time for them to, But the funny thing that only 1 week they know how to use Te Manu for they are fighting over where the laptops were to use the Te Manu. And the others are complaining, oh, why she's been there for the whole of this week? How about us? So we have to do a roster for them so they can take time because they are interested in the Te Manu. So I think that's a good point for
right.
So that's only for the triaging for the outpatients. That's the first part of us to prep for the Te Manu. But it's for the outpatients, well, that's my job to come out to where the crowd is and reassure them, talk to them. Please just bear with us that we are starting a new system in the hospital, so we can. But some the negative, the typical people, Pacific people, they are making excuses and all this stuff, but otherwise it's all went well, and the staff and the people, they go along with this Te Manu thing. But it's really now they're giving feedbacks that, oh, it's very good, your new system, or Thank you. That's all for
I think it's wonderful that you've assumed that role, because sometimes that level of leadership can really be lacking, but it's so important in the adoption of a new system and for getting everyone on board and over the line, especially when there might be people struggling with a little bit of digital literacy and typing, etc. As you bring up, it's a really important point. So well done.
Thank you.
Whitney, I know you love to talk. It's been too long over there. So we've done some review of requirements. How do you then, or how did you in Palau map those requirements to the Nauru system and complete any user acceptance testing to ensure workflows and system design would meet the user needs and needs of Palau?
Well, with any given circumstances with technology, and so I would identify that the challenge was the end users, and so it's hard to implement technological workflows into an existing workflow of people who are so used to handling face-to-face interactions and paper data. And so I think we already had a standardized concept on visuals on what to do in our work, on mapping our workflow. And it's just because our prior system was an Access database. And so I think it was just more of like tightening up and improving our security and our workflow processes to make sure it's in line with how Tamanu operates and how we can negate some of the workflows that does not make sense and just give us like more more things to do than it is to kind of eliminate those solutions. But yeah, and I think the biggest overall mapping to our workflows was the support. Ground support has always been there. Whether it's off island or on island, the support was a tremendous help in putting systems in place to our workflows and our processes.
Yeah,
Thank you.
Just a quick follow-up question before you spoke briefly on the paper, and obviously as Tamanu evolves, we're slowly getting all paper digitized, but there is still the hybrid system of paper digital that exists. So how do you clearly communicate that to your end users and factor that into the workflows that you created?
Right, and so we're not 100% paperless. That would be a dream, and it'll be a lie if I told you we are. But I think it's just our healthcare sector has been used to this paper process for so long that there is some aspects of our healthcare that we cannot just migrate and into Tamanu just yet, just because there's systems that we need to follow and ensure redundancies, and that way we don't have to go step back if anything goes wrong. And so I would say we are like 80-20. 80% paperless and 20% paper.
Yeah, fantastic, thank you. Maybe a quick question for everyone, because I feel like we've already touched on it slightly, but what change management strategies were adopted to promote and socialise the implementation of Tamanu to ensure that smooth transition and adoption of the system?
You can start.
Change management. So we did a lot of trainings. Before we seldomly see nurses out in the facility. But one of the things that we did do and as a method of trying to sustain systems was we upgraded our library into a digital library kind of training room. So that we don't have to take out laptops, seek funding for laptops, but we upgraded the library so that we can fit in more PCs so that we can continuously train the staff. So we set up a training plan for them and then bring them in. Also setting training plans does not need to be a standard form of training. So it depends on the user's needs, what we see needs further training. So some trainings will needs to be done out in their environments where they feel comfortable. And then some trainings we do in the library, where we just take them out because we need their attention more than outside of the city level. And then some trainings we bring them into the main town area. Some trainings we just go out, bring them to the other side of the island, just take them out and experience. They experience what the other facilities are like, because nurse managers tend to not stick to a certain style of doing things. Everyone has their own style of handling trainings and handling implementation of systems. So by exposing one to the other's environment, it also builds a sense of what you call it, sense of confidence and collaboration. And also understand that this is not a system just for one person. We are all in this together. To make it work, we all need to work together and share ideas on how to further improve the system.
Vae, or Whitni, did you want to add anything to kind of your change management strategies? Yeah.
And for Palau, it wasn't, I think it was more on enhancing our security and data protocols more than a change management. And I think it's a testament to Manu, because it's the ability for it to kind of adapt to our operational needs and not having us to have to change processes. And the change of the process was just more to kind of enhance privacy and security functions, and really less on operational MOUs. Yeah.
Fantastic. Did you want to add anything on any strategies used in Nauru?
The strategies that I think the training is one of the strategies. We just help us really well in the training of the staff, as well. We have a large amount of expat nurses, so where they come from, there's no they've never been used at Samoa. So rule out the training with all the nurses within 2 weeks time. That's quite a big number, but we have to plan properly with the nurses rosters and make sure everybody comes and attend the training. Yeah, but if they are missed from that day, I have to call them to come and attend the next day, which extra work for Josh too. Because we just cater for 15 participants for the training for the day. Yeah. So, but it's really going to work. Not only the nurses but the doctors too, and allied staff for the hospital. Yeah.
Fantastic. Thank you to Josh from the sounds. Yeah, please.
So one of the other things that we do under the e-health policy and strategy, there's supposed to be 2 subcommittees. A subcommittee for ensuring the health data side of things is addressed, and then there's another subcommittee for the infrastructure. So each subcommittee is supposed to meet and then try and address issues specific to infrastructure, but because of the lack of human resource, no staff, we enforce and encourage meetings on a weekly basis. And we include our BS local consultant in the meeting so that he's also well aware of the developments that we need to have. By regular meetings and encouraging regular meetings, we are on top of the changes, on top of the processes, once challenges are addressed or issues come up, we are on top of trying to address them. Of course, there are challenges, our system is still not yet 100% there, but progress is progress. We will get there.
Yeah. Fantastic. I think that touches and covers on quite a few questions with regards to training, but also change management after the fact and, keeping track of requests and changes. That's fantastic. Lenara, I might hand it back over to you. So kind of we've looked a little bit at the planning now into the preparation for a go live or launch of the system itself. This has come up multiple times, but I guess a little bit more specifically, what does planning look like in Samoa to ensure a stable infrastructure for Te Manu and accessibility to hardware devices? What did that preparation look like? Because obviously if users don't have access to Te Manu or it's inaccessible, frequently, the desire to revert to paper is very strong.
So I guess this challenge is not unique to Samoa, where there's very limited funding, but we have a health program advisory committee made up of and donor partners attending the meeting with the CEOs of important sectors like the Ministry of Women, the Ministry of Education. So in that committee, we get to present the status of where we're at. And it's also the opportunity for us to sell our e-health situation. And also because usually systems will be funded. We've been fortunate to be to have our Te Manu enterprise funded by DFED, but other donor partners are there. So this is just the time for us to sell. So we get funding to upgrade our health training facility. We get funding to procure more computers. And I think we've been selling the system and our ecosystem really well because we've been getting really good funding support through the years. And I think one of the things that donor partners want to see is results. And that's something we've been working really hard to try and get results in. Sometimes also we take time with processes. Like we're waiting for that perfect time when things are all going to work. But I find that there will never be a perfect time and there will never be a perfect system. So whenever there's small progress, we just capitalize on that, push through and train our system. We only had a team of 10 for health, Ministry of Health of nearly 2,000 staff and a population of 200,000. But we've been working really hard, and I think I've been multitasking the team. One of the other very important thing is very good communication, and also investing in a team that has the same vision and the same drive. So even if they're not paid extra, but they are still able to. They see what we're trying to achieve. So even if you tell them today, okay, you're going tomorrow to do training they just go happily and go to the other island and do training. But even that is not sustainable. Hence why we also leverage on trying to ensure our users are empowered to train. One of the things with these type of implementations, we don't want ICT to overpower these types of developments. As these are for health users. So the health users need to take ownership of the process, or else they'll be asking, they need a data officer here, they need an ICT staff here, which is something we will never be able to achieve. But with them taking ownership of the process, understanding the value of what we're trying to do, them understanding why they need to enter the data, information they're getting out, how it's going to help them with their work, make their work easy, then those are the processes.
And all with a team of 10, I feel like that deserves a round of applause. That's amazing. It's really, really fun. I might hand over to you now. Within the hospital in Nauru, I know you spoke briefly on perhaps struggling with typing and the change to a digital system. But how did you adopt any other strategies, or what strategies did you use to combat any staff that might be resisted to the change and the introduction of Tamanu?
Yeah. Um, Thank you. That's a good question, Dan. Well, we come across staff that who are resistant to the new change. So, but we reassure them, and we just give we just make a roster for them to when there is like Tuesday, Thursday, not really a lot of outpatients. So we just give a chance for her to sit there, and because maybe 2-3 people are coming, that's so she won't get panic or if there's a lot of crowd outside. Yeah. So yeah. And some of the doctors too, we face them, those very, very old. Yeah, but well, they still insist, but these are expensive. But he left, he went home. But the others, they continue trying their best to try and comply with the Tamanu. Yeah.
That's fantastic to make room and for that extra support, really brilliant. Yeah, well done. All right, so we've prepared for the go live, we've got the system ready, the infrastructure's in place, we're feeling good. The hotly anticipated go live. Whitni, in Palau, what did go live support look like, and how did you ensure that clinicians felt supported through the process and transition to the new system and to Tamanu?
Well, I think it was really anticipated. Prior to Tamanu, this is actually our third try on an EHR. And so it was heavily anticipated. Prior to the launch, there was demos and trainings, and so people started to see it as something very user-friendly compared to past EMRs, so EHRs. And so I think it was well anticipated, and first go live, people were excited. People were excited to use it. You know, it was user friendly. I mean, the system compared to it now, it's probably a little bit different with all the new add-ons to it. But you know, it was simplicity at its best, and you know, and I think one of the things that that really mattered was that there was support. There was support from going live to going live and post live. And so, you know, the system kind of, you know, had any technology has problems. So, but, you know, it was settled, you know, and the excitement of the usage and kind of going away with writing and, you know, was, I think, what everyone was like, wow, I can actually read what the doctor is telling me to do. You know, so I think with that excitement and what they were looking forward to, what's gonna come next was the drive of kind of pushing forward. Yeah.
Nice, and I think the post go live is a really important point to touch on there, because the support doesn't end with the go live itself, and it should be ongoing, continue for the system. So that's really important point to touch on.
Right, and just to add on, I would just like to share, I'm with the Palau team, and it shows BS on my shirt. So people are probably confused. So this is part of the support system that's provided. And so I was currently, I'm a local, hired by BS to train, to learn how to work the system and be the support for longevity of the project. And so I'm with them for a year, and I'm under their hands to mold, and then I'll be the support system and kind of like the bridge to liaise between the Ministry of Health and Beyond Essential Systems.
Yeah, fantastic. I think what we're seeing in Palau is some great forward planning for the sustainability beyond BES support and into the future, which is really great to see. Yeah. I have lots of questions that I would love to keep asking all, but I'm gonna ask two more, and then I'll hand it over to Fran for some Q&A. Lenara, I've got one last question for yourself, especially in the with the size of the implementation in Samoa and it growing as well. Te Manu is a rapidly evolving software, which is fantastic, but I'm sure it comes with the price of ensuring with each change workflows are being reviewed, that staff and clinicians are being updated on what those changes are and how that impacts their day-to-day work and potentially any additional training as well. How do you prepare for go lives and communicate the changes to the users of Te Manu?
Preparing our staff, I think train, meet, continue, even if we don't want to see each other, we still call meetings. And even if one person or two persons turn up, quality over quantity. I think also just taking a positive outlook on situations and continue to push and encourage the staff to be involved with the processes. Preparing for go lives, during go live and post. Communication is something that needs to be ongoing. So it will need to be consistently keep them engaged. And also by getting feedback from the staff, it further improves the system. One of the other features of the system that's really good, and I think it's something that we really leverage on, is the ability to view live data and view data in a timely manner so that our monitoring and evaluation division can monitor. Because it's one thing to develop a system and get it out, but also to monitor the progress and whether it's progressing, whether the investments we made is there. And also, this is saying the customer is always right for health information, the user is always right. So whatever complaint they give, issues they have, we just agree with the issues, and then we call meetings, and then we resolve it.
Yeah. Fantastic. And I know Vae as well, just quickly, that you have as well to kind of support the ongoing enhancements of Te Manu, some technical working groups and committees in place to discuss improvements to the system and change requests from the clinicians. Could you talk us a little bit about that committee and how that works in the room?
We have that committee, the technical working group, that's involve myself, the DMS, and in charge of his health information system. Yeah, it's I think it's a fortnightly meeting or weekly. Josh will email to us to attend the meeting. Yeah, so we want to discuss what we need to add, or if it's this for example, this the admissions for the patient, we need to carry on with that, or we need to change, or it's a good technical working group. It's really helped with our work also. With the great help of Josh in giving us the advice and
Fantastic, and really important and crucial to ensuring the sustainability of the system as well. So that's really great. All right, a very quick rapid fire question. One key success and one thing you would do differently next time. Just very quickly, and then we'll hand it over for Q&A.
So I think one of the key successes, having those technical working groups, those are very helpful to ensure. And then what was the point?
What would you do differently next time?
What I would do differently next time is maybe start a technical working group in the beginning. And to kind of see, iron out all the, the processes where people are kind of question mark and kind of ensure, how it actually will be implemented. And I think that's where we could have done better.
Yeah, great, and I guess how decisions were made and being able to communicate that back, yeah, great.
Okay, so we haven't start off with the, what's the name of Senate? Is it now dreaming, but maybe before we roll out that, we can have a proper, clearance. So maybe a technical working group, so we can really look at other things that we haven't done properly during the command. Yeah, I think that's the things that we can do differently.
Yeah, fantastic. Right,
I guess success for us, 50-50, still working on trying to get everyone on board. But success is the fact that we are using the system already. As we planned out from the start, we were going to start clinical outlets into the health facilities, but now we're starting from out in public health, coming back into clinical, which is we've taken a reverse step of things, and we were not quite sure it was going to work out at first, but I think now it's actually worked out better than we had anticipated. So I guess that we consider that success. Well, so many things. If we were given time to start over again, I would have chosen to work at health a bit earlier. I think, or maybe not, because I'm too young and I'm really hungry. Thank you.
A good note.